So I'm going to show you how to perform the ultrasound guided extraforaminal injection. When we use ultrasound, we are not doing a transforaminal injection. We are actually staying outside the foramen. That's why it's an extraforaminal injection. Start to scan in the midline in order to know the level. So on this image, you are now seeing the structures like tracheal rings, and then you have you're also seeing the part of the thyroid gland, esophagus. Along with that, you have structures like thyroid ema artery, which is supplying to the thyroid gland. You have carotid artery, and below the carotid artery, you have a longus colli muscle. You have an internal jugular vein, which I'm pressing it now. Once you see a bony landmark at the bottom of the screen, then you know you might be looking at C7 or C6. Now, how will you differentiate between C7 and C6? At the level of C7, there is a posterior tubercle, so you can nicely see here that's the vertebral artery, and he has a very rudimentary posterior tubercle. Let me freeze the image and I'll try and show you the rudimentary posterior tubercle. So here in this image, you can see straight line along with a rudimentary posterior tubercle. I call this as a lounge chair position. The difference between C7 and C6, C6 has an anterior and posterior tubercle. So we will now do a dynamic scanning, and that will help us to visualize. Now from C7 level, I'm moving up, my probe is going up, and now we can start to see the anterior tubercle of C6 coming into the view, and I'll show that to you here on the screen. So this is a C6 anterior tubercle, and then you will see this nerve root of C6 and this posterior tubercle on the live model scanning. So we'll do a dynamic scanning which will help us to visualize that. So here we have anterior tubercle, and then you have posterior tubercle, and then you have a nerve root that's coming between the two. And here, to perform the cervical selective nerve root block, this image is quite a good image to do this. We have anterior tubercle, we have posterior tubercle, we have nerve root. You'll be bringing the needle in plane from lateral to medial or from posterior to anterior this way, and then once the needle is at the level of posterior tubercle, you will inject about 1 cc of 1% lidocaine or other local anesthetic along with dexamethasone as a non-particulate steroid. Before that, I would always recommend using a contrast dye. Do the x-ray to make sure that the needle tip is not in the vessel, and you will inject local anesthetic and steroid. Thank you.